Hey everyone, welcome back to Shock Doc Medical. I'm Dr. Rod, and today we're diving into something that might seem basic at first, but trust me, it's a game changer in clinical practice. Have you ever wondered how a thorough skin exam can reveal so much about a patient's overall health? Not just the obvious rashes or lesions, but the subtle clues that can guide us to a correct diagnosis? Stick around because we're unpacking every detail on how to examine the skin like a pro. All right, so let's set the stage. Today's episode is all about the examination of the skin. I know what you're thinking. Dr. Rod, isn't this something we already know? But hear me out. Getting the basics right in a skin exam is as crucial as checking the heart or lungs. We're talking about a full body investigation, from head to toe, nails to mucous membranes. And if you're a doctor or a medical student, mastering these techniques can literally save lives. First things first, preparation. Picture this. You're about to see a patient and you're ready to do your skin exam. What's the number one thing? Get the basics right. And by that, I mean inspect all the skin, not just the areas that look obviously problematic. You want to be as accurate as you would be with respiratory or cardiovascular signs. Think of it like painting a full portrait instead of just sketching a rough outline. Now, before you even lay your hands on the patient, it's crucial to explain what you're about to do. Ask for consent to examine the entire skin surface, not just the problem spots. This not only puts the patient at ease, but also builds trust. You've got to ensure that the patient is warm and comfortable. I always keep a sheet or blanket handy, so I can expose the necessary areas and stages while still keeping the patient covered. And hey, always ask if the skin is tender before you begin. A little courtesy goes a long way. Now here's a fun fact. The skin is not just skin. You've got to remember to examine the nails, scalp, hair, and even the mucous membranes. I mean, think about it. Your nails can tell you a lot about your health, from nutritional deficiencies to systemic diseases. And don't forget, sometimes what's hiding under a dressing or behind makeup, dentures, or even a wig can be incredibly telling. It's like being a detective. Every clue matters. And for those sensitive areas, like the genitalia, remember that having a chaperone can be important. Not only for the patient's comfort, but also for maintaining a professional and respectful environment. Sometimes you might even need a nurse to help with dressings. It's all part of creating a safe, supportive space for your patient. Now, let's talk about something that might sound trivial, but is absolutely critical: lighting. Most clinical areas just don't cut it when it comes to lighting for skin exams. Imagine trying to read a comic book in a dark room. It just doesn't work. Ideally, you should be working in bright ambient lighting that's as close to daylight as possible. And if you need to check inside the mouth or those awkward skin folds, mobile supplementary illumination is your best friend. Seriously, good lighting can make or break your examination. All right, let's get up close and personal. Literally. Some of you might have seen dermatologists using a hand lens or magnifying loupes for that extra detail. These tools help you inspect skin lesions up close. And when it comes to those tiny blood vessels in the nail folds, you can use an ophthalmoscope with a drop of immersion oil. But if you really want to nail it, a dermatoscope is the way to go. This nifty device can even confirm a diagnosis of scabies by revealing those pesky mites burrowing in the skin. And when assessing pigmented lesions, the dermatoscope is indispensable, although it does take a bit of expertise to interpret what you're seeing. It's like having a superpower, but you've got to train to use it. Ever heard of a wood light? No, it's not some kind of magical black light from a rock concert. It's actually a clinical tool that emits ultraviolet light in the long-wave UVA region. This tool is super useful for assessing conditions like hypo or hyperpigmentation and even certain cutaneous infections. Imagine being able to see the invisible, all thanks to a little UV magic. It's just one more way to ensure you're getting the complete picture. Okay, so you've done a thorough exam. Now what? You need to record your findings meticulously. This isn't just scribbling notes. It's about creating a clear, detailed map of what you found. I like to think of it as drawing a treasure map. Use a body map or simple diagrams to show the distribution of any rash or tumors. And here's a pro tip. Always record the maximum dimensions of any tumor. It might seem tedious, But these details are gold when you need to track changes over time. Some of you might even snap clinical photographs to document a rash or tumor, but remember, always get consent first. This isn't just a legal requirement. It's about respecting your patient's privacy and building trust. So to wrap this up, let's put it all together. A proper skin exam isn't just about looking at a rash and moving on. It's a comprehensive process, starting from preparation, explaining your process, and getting patient consent, to examining every inch of the skin, nails, hair, and mucous membranes. And it doesn't stop there. You've got to use the right tools, adequate lighting, magnification devices like dermatoscopes, and even wood lights to ensure you're not missing any details. Finally, documenting your findings accurately is essential for tracking the patient's progress and making informed decisions about treatment. Let's be real. This is all about making a difference in patient care. When we take the time to do a thorough skin exam, we're not just checking boxes. We're potentially catching early signs of serious conditions. Imagine the impact on someone's life if a skin lesion turns out to be a melanoma, or if subtle signs point to a systemic disease. It's these little details that can lead to early intervention and better outcomes. And for you fellow clinicians out there, think of it as building a relationship with your patient. The care and attention you show during a skin exam can really set the tone for the entire visit. It tells your patients that you're thorough, that you care, and that you're committed to their overall well-being. Now, I want to hear from you. What are some of the challenges you've faced in performing skin exams? Have you found any tricks or tools that make a difference? Drop your thoughts and experiences in the comments below. I love hearing your stories, and they help us all learn and grow as medical professionals. Also, here's a quick recap of some expert insights. Always ensure the patient is comfortable, use the best lighting and tools available, and document your findings meticulously. These steps might seem simple, but they're the building blocks of effective diagnosis and patient care. If you found today's deep dive into the skin exam process as enlightening as I did, smash that like button, subscribe if you haven't already, and share this episode with your colleagues. Let's build a community of curious minds who are passionate about elevating patient care. And don't forget, this is Shock Doc Medical, where we break down the complex world of medicine into actionable insights for everyday practice. Whether you're a seasoned doctor or just starting out, there's always something new to learn, and I'm here to guide you through it. Before we wrap up, here's a little teaser for next week's episode. Imagine a breakthrough that could revolutionize how we diagnose and treat early-stage skin cancers. Intrigued? Stay tuned because we're going to explore some cutting-edge research that might just change the game in dermatology. Thanks for hanging out with me on Shock Doc Medical today. I'm Dr. Rod, reminding you that in medicine, the devil is in the details, and sometimes the smallest observations can lead to the biggest breakthroughs. Until next time, stay curious, keep questioning, and as always, take care of yourselves and each other. Don't forget to join the conversation in the comments, and if you have any questions or topics you want me to cover, hit me up. Catch you in the next episode.